Does this sound familiar? It is 3x a.m., and once again, you are up making your pilgrimage to the bathroom. It is not the first time tonight. This constant interruption does not just wreck your sleep, it steals your energy, your clarity, and your vitality for the entire next day. You feel frustration consuming you with every trip through the dark, while your partner, of course, sleeps completely undisturbed. And you wonder, why me? Is this simply what aging feels like? Many people believe exactly that. They resign themselves to chronic fatigue, the fear of stumbling in the dark, and the quiet acceptance that they will never sleep through the night again. But I am here to tell you something very clearly. It does not have to be this way. You do not have to accept a life of interrupted sleep and exhausted days. I am Dr. Lauren Hayes, a physician with over 20 years of experience dedicated to understanding the bladder and urinary system and how profoundly sleep disruption affects overall health and quality of life. Thousands of women and men just like you have come to me feeling desperate and completely hopeless. But time and again, I have witnessed truly remarkable transformations. Today, I am not here with generic advice. I am sharing a key strategy in urology, a method about how, and more importantly, when to drink water that will finally allow you to reclaim your nights. It is a technique so simple, so logical, and yet so consistently overlooked that you will genuinely wonder why nobody told you sooner. Stay with me because this knowledge will not just change your nights, it could change your entire life. Before I give you the solution, I want you to understand the true scope of what we are dealing with here. Did you know that up to 70% of adults over 60 wake up at least once a night to urinate? And for many, it is 2, 3, or even more times every single night. This has a clinical name, nocturia. And let me be absolutely clear, while it is extremely common, it is not normal. It is not a harmless toll of aging. It is a warning signal from your body, a siren blaring through the night. And the consequences of ignoring it are far more serious than most people realize. Stay with me to the end because I will reveal not just why this happens, but the precise strategy, the exact method I teach my patients to finally break this exhausting cycle. The final revelation could change your nights permanently. We call nocturia a silent epidemic for a very specific reason. People do not talk about it openly. They suffer privately with shame or quiet resignation. But in my practice, I hear the real stories every single day. I hear from Margaret, a 72-year-old grandmother who loved tending her garden and had to stop because her hands trembled and her balance failed from chronic sleep deprivation. I hear from Susan, a 68-year-old retired teacher who fell and fractured her hip on one of her nighttime bathroom trips, an accident that permanently cost her the independence she had worked her whole life to maintain. These are not simply anecdotes. They represent the harsh, daily reality for millions of older adults. The problem extends far beyond feeling tired. Let us talk plainly about the genuine dangers hiding behind these nightly bathroom trips. First, the risk of falls. In the dark, half asleep, your balance is significantly compromised. The path to the bathroom becomes an obstacle course, a rug, a piece of furniture, and the consequence could be a life-altering injury. For an older woman, a hip fracture can mark the beginning of rapid physical and cognitive decline. Second, the impact on cognitive health. Deep sleep is not a luxury. It is a physiological necessity. During sleep, your brain consolidates memories, clears accumulated toxins, and performs critical maintenance. When your sleep is fragmented night after night, that essential process simply does not happen properly. The result is brain fog, difficulty concentrating, poor memory, and over time, a meaningfully higher risk of neurodegenerative disease. It is not age making you feel forgetful. It is the chronic deprivation of quality sleep. Third, the strain on your heart. Every time you wake suddenly, your body releases stress hormones. Blood pressure and heart rate spike abruptly. If this happens multiple times each night, you are subjecting your cardiovascular system to constant repeated stress. Multiple studies consistently link severe nocturia to higher rates of hypertension and serious heart conditions. And finally, the emotional toll. Chronic fatigue steals your joy. It makes you irritable, anxious, and over time can genuinely contribute to depression. It pulls you away from the activities and people you love and traps you in a cycle of exhaustion that feels impossible to escape. You stop being fully yourself. Why does this happen as we age? There are several interconnected reasons worth understanding clearly. First, your body produces less antidiuretic hormone, ADH, at night. ADH signals your kidneys to slow urine production during sleep. With declining ADH levels, the urine factory keeps running at full capacity throughout the night. Second, bladder capacity may gradually decrease with age. Third, something very few people ever hear about, fluid redistribution. If your ankles swell during the day, that fluid does not simply disappear when you lie down. When you are horizontal, gravity stops holding that fluid in your legs. It returns to your bloodstream, passes through your kidneys, and ends up in your bladder, waking you a few hours after you fell asleep. Now that you understand the genuine seriousness of this problem and the science behind it, we are ready to dismantle the myths and build the real, lasting solution. Before revealing the correct strategy, we must first stop doing what is actively making things worse. Most people with the best intentions make mistakes that worsen nocturia significantly. Let us address the three most common myths directly. Myth 1. To avoid urinating at night, I should drink as little water as possible during the day. This is the most common mistake, and genuinely the most counterproductive one. It seems completely logical. Less water means less urine out. But your body does not function that simply. When you dehydrate during the day, your urine becomes highly concentrated. That concentrated urine actively irritates your bladder walls, like pouring lemon juice directly onto a wound. That irritation makes your bladder hypersensitive, sending urgent signals even when it is not genuinely full. And when you finally drink something in the afternoon to address built-up thirst, your body attempts to process all of it at once, often during the night. Paradoxically, drinking too little during the day can directly cause more bathroom trips at night. Myth 2. The problem is, I have always had a small bladder and nothing can change that. While some people do have reduced functional bladder capacity, in the vast majority of nocturia cases, the issue is not the size of the bladder, but the pace of the kidneys during nighttime hours. Lower ADH production and fluid returning from the legs are the real physiological culprits. You could have the largest bladder imaginable, but if your kidneys are continuously producing urine through the night, you will wake up regardless. Accepting this explanation keeps people from ever addressing the actual root of the problem. Myth 3. A glass of wine in the evening relaxes me and helps me sleep, so it cannot be harmful. This myth is particularly damaging. While alcohol may create initial drowsiness, it fundamentally sabotages your rest, especially regarding nighttime bathroom trips. Alcohol is a potent diuretic, but worse, it sharply suppresses the release of ADH. So when you drink alcohol before bed, you create a particularly harmful combination. You are taking in liquid while simultaneously switching off the mechanism your body uses to slow urine production overnight. This is essentially the perfect formula for nocturia. Avoiding alcohol, particularly in the hours before sleep, is one of the single most effective changes any woman over 60 can make for her sleep quality. Now that you understand what does not work, you have taken a genuinely significant step forward. You have cleared the ground. Are you ready for the strategy that actually produces lasting results? Here is the heart of everything I want to share with you today. This is the method that has given countless patients their sleep back. Forget drinking less. The new principle is drinking smarter. The ASIM method is a 5-step strategy that is straightforward to remember. ASIM stands for Adjust, Soften, Stop, Integrate, Manage. Let us go through each step carefully, and then I will add 2 additional keys that complete the protocol entirely. Step 1, A. Adjust your hydration. Drink more in the morning. The foundational principle is to front-load most of your liquid intake into the first half of the day. The golden rule I give every patient is this: aim to consume 75% of your daily liquids before 4 p.m. How do you achieve this practically? When you wake up, begin with 1 or 2 full glasses of water to activate your system and start your kidneys working during the hours when you are upright and active. Throughout the morning, keep a water bottle accessible and take steady, consistent sips throughout. Do not wait until you feel thirsty. Thirst is already an early indicator of dehydration. With lunch, drink another glass of water. By doing this consistently, you give your kidneys the entire day to process liquids while you are moving and active. By 4 p.m., you will be properly and completely hydrated, and you can now begin preparing your system for rest. Step 2, S. Soften the transition. Reduce gradually. From 4 p.m. onward, do not cut off water abruptly. We enter what I call the landing phase. From this point until dinner, reduce your intake. Perhaps half a glass if you feel genuinely thirsty. Dinner is critical here. Try to eat at least 3 full hours before bed, and during dinner drink only enough to comfortably swallow your food. A few sips is appropriate. A full glass is not. This gradual, deliberate reduction signals to your body that it is time to begin slowing urine production in preparation for the night ahead. Step 3. S. Stop in time, the sacred zone. This is the strictest and most important step in the entire method. Create a sacred window of 2 full hours before bed, during which you consume absolutely no liquids whatsoever. If you go to bed at 10 p.m., your last drink is at 8 p.m., no exceptions. This 2-hour window is the time your kidneys need to complete their final filtering and deliver that last urine to your bladder before you fall asleep. If you drink anything within those 2 hours, it is almost certain your kidneys will be actively producing urine when your head touches the pillow, setting you up for a 1 sow or 2 sows a.m. bathroom trip without fail. If your mouth feels dry, rinse without swallowing or take the smallest possible sip, but never a full glass. This rule is sacred and must be respected without exception. That is the core of the ASIM method. Now come 2 additional steps that elevate the entire protocol significantly. Step 4. I. Integrate electrolytes, improve absorption. This is a practical technique to help your body use water more efficiently throughout the day. Hydration is not simply about drinking water. It is about getting that water effectively into your cells where it is genuinely needed. Electrolytes facilitate that process beautifully. The approach is simple. In your very first glass of water each morning, add a small pinch, just a pinch, of unrefined sea salt and a splash of fresh lemon juice. The salt provides sodium, which helps water absorb into cells efficiently. The lemon contributes potassium. This simple morning addition can make your entire day's hydration considerably more effective, meaningfully reducing the afternoon and evening thirst that leads to excessive drinking at the wrong time. Step 5. M. Manage your dinner. Control the saboteurs. What you eat for your final meal matters just as much as what you drink. For dinner, actively avoid spicy or acidic foods which directly irritate the bladder lining. Avoid excessive sugar or simple carbohydrates, which can increase urine production overnight. Avoid high water content foods like soups, watermelon, or cucumbers. Enjoy those earlier in the day when your body has time to process them. Avoid chocolate and caffeine. Both are bladder stimulants that many people genuinely do not realize affect their overnight urination patterns. And obviously avoid coffee, tea, and sodas in the evening entirely. Instead, choose a dinner centered on lean protein and cooked vegetables. This keeps blood sugar stable, supports overnight recovery, and does not overburden your urinary system during the hours you most need it to be quiet. There you have it, the complete ASIM method, not magic. Applied science working in alignment with your body's natural physiology. If the ASIM method is the engine, these supporting techniques are the components that maximize your results. Support technique 1, double voiding. Make certain the tank is completely empty. Have you ever gone to the bathroom right before bed only to feel the urge again 20 minutes later? That happens because your bladder was not fully emptied the first time. The double voiding technique is simple and remarkably effective. Right before bed, go to the bathroom. Sit fully on the toilet and allow your pelvic floor muscles to relax completely. When you finish, do not stand up immediately. Wait 30 to 60 seconds. Relax your entire body deliberately. Now lean forward slightly and attempt to urinate again. You will be genuinely surprised how often meaningful additional urine is released. That additional emptying can represent the precise difference between sleeping through the night and waking at 3 a.m. Make this your non-negotiable nightly ritual without exception. Support technique 2. The gravity elevator. Address fluid redistribution proactively. Remember the fluid that accumulates in your legs during the day and returns to circulation when you lie down. We can address that process before bed rather than letting it wake you up afterward. 1 to 2 hours before sleep, while reading, watching television, or simply relaxing, elevate your legs above the level of your heart. Prop them comfortably on pillows on the arm of the sofa or at the elevated end of your bed. This uses gravity to your advantage, encouraging that pooled fluid to return to circulation before you lie down for the night. Your kidneys will process it while you are still awake, and you can eliminate it completely during your double voiding routine. Wearing compression stockings during the daytime also helps prevent significant fluid accumulation in the first place. Support technique 3. Salt shaker control. We used a small strategic pinch of salt in the morning, but excessive sodium throughout your overall daily diet is genuinely problematic for nocturia. When you consume too much salt, your body retains water to dilute it. You feel persistently thirsty and drink more at the wrong times. Your kidneys must work significantly harder to eliminate excess sodium, and they require water to accomplish that, which directly becomes more urine at night. Be mindful of processed foods, deli meats, canned goods, and restaurant meals, which are consistently very high in hidden sodium. Cooking at home gives you genuine and complete control over your salt intake. Reducing sodium supports your bladder health directly and benefits your blood pressure significantly as well. We have unmasked nocturia, not as a minor inconvenience, but as a genuine thief of health, sleep, independence, and the quality of life you have earned and deserve. We have dismantled the myths that were keeping you stuck in a cycle that seemed impossible to break. And I have given you the complete tools, the ASIM method, and these supporting techniques to take real and lasting control starting tonight. I want to return to Michael, the model shipbuilder whose story opened our conversation today. After just 2 weeks of consistently following this protocol, he reached out to my office. His voice sounded genuinely different, stronger and lighter at the same time. Dr. Hayes, he said, last night I slept 7 hours straight, 7 consecutive uninterrupted hours. I had completely forgotten what that even felt like. This morning my hands were not shaking. I am back in my workshop. I am not simply sleeping more. I feel genuinely alive again. That transformation is entirely possible for you. Starting tonight, reclaiming your sleep is a decision. The decision to apply what you have learned here with consistency and commitment. Your complete action plan. Adjust your hydration. Consume the majority of your daily liquids before 4 p.m. Soften and stop. Reduce intake gradually through the afternoon and respect the 2-hour sacred zone with 0 liquids before bed without exception. Support your body every single evening with double voiding, deliberate leg elevation, and consistent sodium control throughout the day. You have the knowledge. You have the tools. The power to transform your nights is entirely in your hands right now. If this information genuinely added value to your life, I ask for 3 simple things. First, hit the like button so this video reaches more women who need it. Second, subscribe so you never miss another strategy like this one. Third, and this genuinely matters to me personally, go to the comments right now and tell me honestly how many times you get up each night. Share your number openly. There is absolutely no shame in this community. Only people who understand exactly what you are going through and who are committed to changing it together. By writing it down, you are not just taking your own first step toward better sleep. You are helping someone else know they are not alone in this exhausting struggle. Thank you sincerely for your time and your trust. Now go and prepare for the best night of sleep you have experienced in years. You deserve every hour of it. I am Dr. Lauren Hayes. Stay strong, sleep well, and I will see you in the next video.